Hello everyone, I am Snigdha Bharadwaj, Assistant Professor, ITS College of Pharmacy. I welcome you all in my session. So, in this session, we will be discussing about degradation associated various factors, physical and chemical factors. So, let us get started. Basically, degradation is a condition or a process of degrading or being degraded, decline to a lower quality condition or a level. We must have heard that various pharmaceutical dosage form has its own shelf life, right. So, shelf life means the period in which the drug will remain stable and will not decompose. So, basically as the drug degraded, so it will be of no pharmaceutical use. So, in order to find its stability, we generally analyze the degradation pattern of the pharmaceutical dosage forms. So, degradation is a condition or a process of degraded or like decomposing, right, decline to a lower quantity or quality condition or a level. Pharmaceutical degradation is the incapacity or incapability of a particular formulation in a specific container to remain within a particular chemical, microbiological, therapeutical, physical and toxicological specifications. In simpler words, we can explain pharmaceutical degradation like the product which after degradation or decomposition is of no use, or medicinal value of the product will get reduced, or the product will get expired. In general terms, we can say that. So, basically it is related to chemical, microbiological, physical, like in physical factors we may observe color changes, in chemical some sort of reaction due to reaction. So, it may be visible, it may not, and microbiological, the attack of microbes in the formulation. For example, liquid formulations are really susceptible to microbial attack due to the solvent properties, like for polar solvents the more microbial attacks can be expected. So, in that case, to avoid that degradation from microbe, we generally add antioxidants and preservatives and toxicological specifications as well. So, sometimes if the drug once degraded, it may be toxic. So, it cannot be further used for medicinal purposes. So, these all are comes under pharmaceutical degradation. Now, types of pharmaceutical degradation may be divided into three major types: physical degradation, chemical degradation and microbiological degradation. So, physical degradation, chemical and microbiological all are related to their like for physical degradation, if we talk about, then any sign change or symptom change or organoleptic property change, that means color, odor, sense, taste. So, this will come under physical degradation. Chemical degradation means chemically incompatible excipients react with each other and results in a incompatibility or result in a degradation of an active pharmaceutical ingredient. Microbiological degradation means the degradation or decomposition because of the microbial attack in the formulation that may reduce the efficiency of a active pharmaceutical ingredient. So, we will discuss these types in detail. So, first, physical degradation is the degradation which results into the change of physical nature of drug. Basically, physical properties like solubility, partition coefficient, absorption coefficient, or the crystalline form to amorphous form. So, these are physical properties of a drug. So, physical nature of drug may be affected due to these type of degradation. The formulation is totally changed by way of appearance, organoleptic properties, hardness, brittleness, particle size. So, it's not specific parameters, those are written here. It may be of any kind, like if tablet uncoated tablet is in white color, and during storage it may appears like pinkish patches on the surface of a tablet, that will comes under your physical parameter, that the color change or a texture change, a particle size change. So, these all are associated with the physical degradations. Fine. So, physical degradation of drug product. So, what are the various factors affecting the physical degradation, like loss of volatile constituent, loss of water, absorption of water, crystal growth, polymorphism changes, color changes. I would like to explain one thing, like for while formulating various pharmaceutical dosage forms like solids, liquids and semi solids, we generally use the combination of excipients along with that API, active pharmaceutical ingredient. So, in that case what we do, we add some sort of inert excipients to make a formulation. So, first before making the formulation, we must do pre-formulation studies to identify is there any interaction, negative interaction we can say, possible interaction is there with the excipient from excipients and the API. So, if there is, it may affect the physical stability of a dosage form, may be chemical and microbiological with the attack of microbes. So, first we need to understand what are the various factors which affect physical stability or may prone to physical degradation of the formulation. Loss of volatile constituents. Volatile constituent, if a drug for example is of a volatile nature, if it is like lost during the storage period through the container due to like if it is to be kept in glass container and we generally use plastic containers. So, in that case we can say that plastic has its own disadvantages because it serve as a penetration medium or permeation medium, and volatile substances may get evaporated and vaporized through the plastic containers. So, it may also leads to physical degradation of the component, because the main component, volatile component will get lost during the storage period. So, physically maybe the preparation may get dried if it is liquid. So, all these formulation parameters also serve the important role. What are the different factors? Loss of water. If we talk about liquid preparation, so in majority of liquid oral preparations, so water is the main vehicle for the liquid preparation. So, if it is lost through the container and during the preparation, the product may get affected and may be susceptible to degradation, absorption of water. So, for vice versa, if the product is dried or formulation is dried like solids, for example, solid tablet, capsule, dusting powders. So, if it is absorbed the moisture from the environment when kept in the containers while storing, so it may get liquefy or may get if the hygroscopic nature drugs, hygroscopic means tendency to absorb moisture from the environment. So, it may get liquefied. So, because of that particular reason the physical appearance of the formulation may get affected, and it may be a reason of the degradation of pharmaceutical formulation, and it cannot be further used for that purpose. Crystal growth. Crystal growths, like for example, the drug in semi solids or solids and in liquid. So, the different types of dosage form are there, and in which we use different kind of excipients. Like in solids we generally take powders of excipients and API, and liquids solution, suspension, emulsions, elixirs are there, and in which, so in any case if crystal is growing or in suspension, for example, it is to be said like for a stable suspension, the particles present in the system must be suspended all throughout the system, right. So, if the particle is getting attracted towards each other, and it will make a colloids or agglomerates, and then it may like it may cause the phase separation of the suspension. So, sometimes due to these physical changes, the stability of the preparation, liquid preparation may get affected. So, these are the most often possibilities seen in case of suspension as well as emulsions. Phase separation sometimes. So, if once phase separated, the formulation is not cannot be used further. Polymorphism changes, for example, the nature of the crystals in the preparation will get changed due to the incompatibilities between excipients and the API. Color changes, yes, this is the most common symptom of any kind of degradation, let it be physical, let it be chemical. If any chemical reaction occurs during the storage, so this can be seen or cannot be seen through the organoleptic changes like color, taste, odor. So, sometimes we do not taste and smells the product, because all the pharmaceutical products have their a unique odor. So, sometimes we usually see the color change, it is a most common symptom of degradation, and it comes under physical degradation. So, now loss of volatile content. Medicinal agents such as iodine, camphor, menthol, ethyl alcohol, anesthetic, ether and chloroform have a tendency to evaporate from the product during storage. So, these are the particular examples you can write and you can see that these have the tendency. Camphor has its volatile nature. So, upon storage it may get evaporated and lost from the pharmaceutical preparation. So, the purpose of using this camphor will not be successful. Similarly, nitroglycerin tablets may lose their potency owing to volatilization of the medication. So, in case of nitroglycerin tablets, generally they lose potency while keeping in storage. So, it result in volatilization of the medicines, right. The preventive measure includes keeping the product in well closed container, storing the cool place. That means, we need to avoid the contact of the formulation from the outside environment. So, we can overcome this difficulty or this type of risk by keeping the dosage form in a proper container. Loss of water. Loss of vehicle from the product leads to decrease in weight, raises the dose of drug and increase potency. Yes, if the total amount of drug is getting reduced, because if we say liquid preparation is of 100 ml and loss of water, the water is the main vehicle, and if it is reduced to 50%, then the concentration in 100 ml will be considered or calculated as per 50 ml. Then the potency will increase of the drug, and it may be sometimes very serious, it may cause very serious effect, because the dose should be uniform all over the product. So, such water loss cannot be accommodated in the particular type of cases which has potent drugs. For example, efflorescent substances such as borax, caffeine, quinidine sulfate have a natural tendency to lose water, right. So, loss of water from the emulsion and semi-solids resulting in cracking. For example, loss of water. So, sometimes semi-solid preparations like creams and all, if the water loss is there, so it may have a crack look, or you will not apply it on the skin, because it will give you the rough texture. Loss of water depends on the temperature and humidity. The preventive measure includes keeping the product in well closed containers and storing in the cool place, right. So, this is the preventive measure, that well closed container should be there and in store and to be stored in cool place. Absorption of water. Absorption of the moisture from the atmosphere increases the weight of the product, dilutes the preparation, vice versa. When the loss of water is there, then the reduction in the overall gross weight of the preparation will be seen, whereas in case of when the formulation absorb waters, so it will increase the weight and dilutes the preparation and decreasing the potency of overall formulation. Deliquescent substance such as calcium chloride and potassium carbonate have a natural tendency to absorb water. So, sometimes with this type of matters we use desiccators and deliquescent substances, so that it can absorb the excess moisture from the environment. Instead, the formulation do. Gelatin capsules absorb moisture and become soft and sticky. So, this is the disadvantages we can see in gelatin capsules. The preventive measures may be like including storing of such product in airtight container and keeping it in cool place. Crystal growth. Crystal growth is promoted by fluctuation in the ambient temperature day and night or a seasonal. These are observed in the following dosage forms. For example, crystal growth, fluctuation in ambient temperature and formation of small nuclei and then finally crystals. So, in solutions, when temperature is lowered, the solution becomes super saturated with respect to drug. Hence, precipitation and crystal growth of the drug is observed. So, sometime due to temperature change, crystal may form. So, in solutions, when temperature is lowered, sometimes the solution becomes super saturated and small crystal growth will be seen. For example, 10% weight by volume calcium gluconate injection is super saturated solution. In order to reduce the risk of crystallization, the IP suggests the use of calcium saccharate as a stabilizer. So, basically in this particular injection we use calcium saccharate as a stabilizer which inhibits the crystal growth. For example, now next category is suspension. The particles slowly become bigger in size and finally may form hard cake. As I have told you just in the previous slides that in suspension emulsions, the tendency of the particles to become agglomerates and colloids are more. So, we generally add emulsifying agent and suspending agent in optimum range, so that particle will get suspended throughout the system. These crystals, if present in the injection, may block the hypodermic needle if suspension is administered through a needle. So, sometimes these small agglomerates may cause a blockage while giving to a patient. These particles, if present in eye drops, produce grittiness. So, you will feel like some particles are instilling on the surface of eye, which causes irritation. Preventive measures include selecting suitable storage condition to reduce fluctuation in ambient temperature, increasing the viscosity of the product, so that diffusion of solute molecules onto a crystal surface will be hindered. So, when we increase the viscosity of the product, so the feel or the presence of these agglomerates will get reduced. So, storage at ambient temperature needs to be done, including the surface active agents to the formulation. So, yes, of course, when we make surfactants and emulsions, we generally add suspending agents or surfactants and emulsifying agent, but instead the concentration needs to be adjusted as per the purpose or the type of preparation we are making. So, it will inhibits the crystal growth and deposition of drug molecule. Now, next is polymorphism changes. So, polymorphism is the ability of a solid material to exist in more than one form of crystal structure. For example, cortisone acetate form second, it is metastable, which is not the final stage and it is unstable form. So, we call it metastable, which forms in between the process. So, it is more soluble than formulated as aqueous suspension. During the storage, it may converted into form fourth, more stable form. Such changes lead to caking of the cortisone acetate suspension. So, when the polymorphs are taking place in between during the storage of the formulation by changing its form second to fourth, like metastable to more stable. So, sometime it may lead to cake formation. Normally, suspending agents such as methyl cellulose are added to prevent the conversion owing to enhanced viscosity. So, sometimes we increase the viscosity and we add the third agents to stop this particular procedure or converting the one crystal to another form, and that is how we manage to reduce this polymorphic changes. Color change. Color change indicates some kind of chemical and photochemical degradation of active ingredients, dyes or other ingredients. Color fading of dyes is fairly common type of instability. Yes, for example, if we say the color of the preparation will get increased or changed to some other, when we formulate the preparation it was something else, and when we consume that preparation it was in different color. So, this is the common sign of physical instability. So, aspirin tablets become pink when ascorbic tablets turn yellowish brown, adrenaline on exposure to air becomes red. So, these are some common few examples of color change which directly represents the instability, physical instability of the formulation. Preventive measures, the product should be protected from light and air. So, because of this oxidation and maybe reduction and hygroscopic nature, so it may cause these type of color changes and lead to formulation instability. So, physical instability like oral solution loss of flavor, what are the different physical instability problems occur in different formulation, loss of flavor, change in taste, presence of off flavors due to interaction with plastic bottles. Yes, we keep formulation in containers. So, the container choice must be well known to avoid these type of particular degradation patterns, loss of dye, precipitation, discoloration. So, effects are like changes in smell or feel or taste. So, organoleptic properties may get affected. For suspensions or liquid preparations, sometimes physical instability problems like settling of the particles or phase separation, caking, crystal growth are seen. Loss of drug content uniformity in different doses from the bottles, because in each pack size there may be a different kind of instability pattern like happens. So, it may affect the content uniformity in different doses from the bottle. Loss of elegance, if it is like we are packing the formulation from the main tank. So, if the phase separation or instability problem occurs in the tank itself, so it may affect the content uniformity to each pack size. So, loss of elegance also, because the cake formation does not look good and patient will not take this due to its physical degradation. Formulation in emulsions basically. So, creaming and coalescence generally occur during when the drug once degraded. So, loss of drug content uniformity in different doses from the bottle and loss of elegance. So, you can see this picture: emulsion, cream, serum, cream, emulsion. So, the coalescence basically you see the phase separation. Here you can see that the phase is getting separated. So, this emulsion basically creams, oil and water emulsions. So, you see the separation. So, with this case the formulation is not considered to be suitable for administration. Now, physical instability for tablets, change in disintegration time, dissolution profile, hardness, appearance. When we make for solid dosage form, we test them for its rightness. For example, if we are saying that tablet should be hard enough to get disintegrate in the stomach, so that it can absorb well through the lumen. So, it needs to be disintegrated within a appropriate time, for example, within 15 to 30 minutes, so that it can absorb well in the blood or systemic circulation to show its effect. If it is not disintegrating like 1 hour, 2 hours, that means it will move down to the intestines and it will not give the desired effect to a patient. So, changes in drug release, appearance soft or become very hard. So, if it becomes very hard, that means it will not give the desired effect, because disintegration will not occur in stipulated time and then dissolution will get affected. So, semi solids, changes in particle size, consistency, caking, bleeding for example. So, basically the bleeding refers to the color change, loss of drug content uniformity, loss of elegance, change in drug release rate. So, these all are physical instability for semi-solids. For capsule, appearance, dissolution, strength. So, we have heard that gelatin capsules become sticky when prone to moisture absorption. So, it will affect the change in drug release. So, these are references. I hope you understand all the basic concepts of these dosage form. Yes. So, these dosage forms, what are the different physical and chemical factor affecting the degradation, chemical degradation of the dosage forms. So, we will be continuing with the same unit in our next sessions. So, till then take care and stay safe. Thank you.